Hello everyone, welcome. We are having a great live session with consultant Dr. Dhrumin Sangoi regarding where we'll be interacting about few orthopedic foot and ankle surgeries and conditions. So I welcome Dr. Dhrumin Sangoi sir. I am Dr. Kriti. I am a resident medical officer in SL Raheja Hospital, Mahe, Mumbai. I welcome Dr. Dhrumin Sangoi, sir, a consultant orthopedic foot and ankle surgeon with over 18 years of experience in specializing in wide range of foot and ankle surgeries. He's advanced. He has received advanced training in foot and ankle reconstruction, minimally invasive surgeries, arthroscopies through leading international institutions. He is associated with SL Raheja Hospital, Fortis Associate, Mahe, Mumbai, where he offers specialized range of orthopedic care for a wide range of foot and ankle surgeries. His trainings include clinical fellowship of foot and ankle at Royal National Orthopaedic Hospital, London. His diabetic foot fellowship at King's College International Hospital, London. His areas of expertise are a wide range of foot and ankle reconstruction surgeries, foot and ankle fracture management, arthroscopies, minimally invasive injuries, foot and ankle sports injuries, and diabetic foot and charcot management. So I welcome you, sir. Yeah.
Thank you. Yes. Uh, so thanks for the invitation. Yeah, let's start a couple of topics which we'll talk about today. So
Yes,
you
sir.
have a list of questions? Yes.
Yes, I have. Okay, so let's start. Begin with. I would want to know what are the different types of injuries in foot and injuries and deformities in foot and ankle.
Correct. So foot and ankle is basically the pillar of your body. So it is the foundation. It is the pillar, like just like the pillar of a building. It is the base of your human body, and you
Yes.
need a proper structure of foot and ankle to walk normally, walk pain free, to run and do all your sports activities. So there are different deformities which we see in foot and ankle. For example, we have flat foot, which is a very common deformity. We have bunion, which is a deformity of the big toe joint. We
Yes.
have post-traumatic foot and ankle deformities. That is, after an injury, if the injury is not properly managed or if the patient develops arthritis, they develop a deformity in the foot and ankle, which causes them problems in walking.
Yes.
Yeah.
Okay, so I would want to know what is flat foot, when does it start, and what are the causes of it, sir?
Correct. So, flat foot is a very big topic in itself, and we can see flat foot in different age groups. So,
Yes.
right from children, the parents start noticing that the child has a flat foot. Okay, so that
Yes.
is a physiological flat foot most commonly. There are two or three conditions in babies and children which can cause a pathological flat foot. That is, which is
Okay.
not normal, like one of
Yeah.
them is a congenital vertical talus, which is one of the bone in the foot is oriented vertically, which causes flat foot. There is abnormal joining of two bones in the foot that can happen in babies, and that also causes flat foot. So those are the things which we need to pick up early and address in the beginning. Otherwise, majority 80 to 90% of children have a physiological flat foot. That is, as the age advances up to 10 years, the arch automatically develops. So these are the things we see in children. Coming to adolescents, which is around 10 to 18 years, many people come with flat foot. And the pain starts when they start doing sports, when they start playing cricket, football. That is when the pain starts. So in them, the arch has not developed, which is most likely genetic and hereditary. They will say that my parents also had flat foot. So in these patients, you have to start exercises in the early stage of their life. They need to do calf stretching. They need to use insoles in their shoes. Now, insoles are something which go inside the shoes and they have a medial arch. So they support your arch. So that is something which has to be started early on in their phase of life. So that is about the adolescents.
Yeah.
And Many people develop flat foot when they become adults. That is, they had normal arch, but suddenly at the age of 20, 25, 30, their arch starts collapsing. So the cause of this is different. It is not hereditary. It is because of a muscle or a tendon, which is called as the tibialis posterior tendon. Now, this muscle and tendon, it controls the arch of the foot in each and every one of us. And at a
Yes.
particular time, 25, 30, if they have walked far, if they have rheumatoid arthritis or any other condition, that muscle stops working. So the arch collapses. And then they develop a flat foot. And these are the patients who come to us most often in the middle part of life. And if not managed with physio and insoles, they need a surgery for correction of the flat foot deformity. Sorry. And finally, we see flat foot in adult age group, that is around 40 to 50 years of age. Sorry, that means these patients had flat foot in the beginning, but because of their limited movement and activities, it was not detected, and the pain started developing when they reached their 50 to 60 year of age group. And these patients mostly have developed arthritis because of the long standing flat foot. So these are the patients who come later in life, and then we manage them differently. So yeah, these are the various forms of flat foot. Right from child to old age, we see people of all age group having this problem.
Sure. So, does insult really help, or we need surgeries for all situation, also all cases?
Yeah, so very good question. And most of the patients ask that only, that flat foot we see so many people. Do we need surgery or will we manage an insoles and that should be sufficient? So, to begin with, you have to understand that your foot has a flat arch. The arch is not developed. And that is not from the skin part, it is from within. And what is there within? There are bones. So, normal bony alignment is this, if you can see in my image. Everybody has an arch. This is a longitudinal foot arch. There are also transverse arches in the foot. This is the main longitudinal arch. So the people with flat foot, their bones are designed in such a way that the arch is like that. That means bones are flattened out. So the position of the bones is not normal. Now, if it is flexible flat foot, that is with the insoles or by pushing up with the hand, the arch is formed, then that those cases can be managed with insoles and physiotherapy. So we have to assess clinically whether it is a flexible flat foot or a rigid flat foot. Other important thing is pain. How much pain the patient has. Not everybody with flat foot will have pain. Different people have different pain tolerance. Third is what is their activity of daily living. Some people are sedentary, just sit at home and they have sedentary desk job. Some people are on their field, on their toes the whole day. So again, the pain threshold, their activity of living, whether it is a flexible or a rigid, all these, if you fall on one side of the spectrum, that is, you have a flexible flat foot, sedentary job, not much walking, then insoles will manage your problem most of the time and the pain will be controlled. But if you are on the other side of the spectrum, that is, if your flat foot is rigid, if your walking is too much, if you have to go out daily for your walks and you cannot tolerate the pain, then surgery will help you. How? The surgery will realign the bones in the foot and give you a more normal biomechanical structure, which will help you in the long run.
And what surgery is done for flat foot, sir?
Yeah, so again, different age groups, there are more than 100 surgeries described for flat foot all across the world. Methods are evolving, technology is evolving. So we were starting to do very open surgeries with long cuts, but nowadays we have minimally invasive surgeries in foot and ankle where we do surgeries with a small cut, and the recovery and rehabilitation is much quicker. So if you begin with adolescents and children, their surgeries are usually through small cuts, through small wires which we put in the bones to realign them, and then we remove the wires. So these are in younger children, adolescents. If we go in adult age group, which is 30 to 50, we have to repair the ligaments and tendons, because that, as I mentioned, the posterior tibial tendon, which is on the inner side of your arch, is the main culprit. So that collapses the arch. So we have to tighten up that ligament. and we put some internal brace, or there are fiber tapes which holds your arch. So along with that, we have to do osteotomies of both. So this is the adult variety where it is a flat foot where the joints are not damaged. So we do a adult flat foot reconstruction surgery. In that, we use shift the bones and we repair the ligaments to form the arch. And if the patient comes at a later stage, at around 60, 70, 80-year old with pain and flat foot, then we have to realign the bones with bone fusion. So that is the extreme form of surgery where you have to fuse the bones, and that gives them pain relief and forms their arch to certain extent as well. So the surgery depends on what stage you come, what age group you have, and how much is the degree and severity of flat foot.
Okay. We have this totally different set of condition called bunion, which is very much common. So we would like to talk 2 minutes on that. So what is bunion and what are the common causes of bunion?
Yeah, so bunion is basically your big toe. So everybody have 5 toes in their foot, and the big toe, the main toe, it starts bending outwards. Okay, so if this is your big toe, it starts going outwards, and people develop a prominence over this part of the foot, on the inner aspect of the foot of the big toe, which is called the bunion. Many people say that bunion is a bony growth. It is a bony growth, but it is more of a muscle imbalance. The first metatarsal of the foot starts turning inwards. That is why the bony projection comes on the skin, and that is called a bunion. Why bunion causes pain? Number one, footwear. People are not able to fit their shoes in a shoe, so that's why we prescribe them a broad toe box shoe. The shoes should not be narrow; they should be broad in front. Number two, there is a nerve which crosses across the bunion, which causes pain.
Okay.
Uh, and number three, there is a bursa. Bursa is a soft tissue which is bone that gets inflamed, which is called as bursitis. So that bursitis causes pain. So different causes of pain in a bunion, and everybody of us, we stand on 3 points of a foot, which
Foot.
is called as the tripod of the foot, which is your big toe, your little toe, and the heel. And people with bunion, this part is disturbed because they have a toe going outwards, which is also called as hallux valgus. And because of that, the pressure doesn't come here. So all the pressure comes on the little toe and the heel. So that is why they find difficulty walking, difficulty running, playing sports. And over a long run, because of the bunion, people start developing callosity under the big toe. That is because of the constant pressure. The skin reacts by forming thick skin, which is called as a callosity. So this is a bunion basically, and it is also seen in other subset of patients, which is rheumatoid arthritis. We commonly seen in women, middle-aged women, where rheumatoid arthritis starts and the bunion starts developing. So they have bunion with other toe deformities as well. So we see two groups of patients with bunion. One is the younger people, and one is the older people.
And how are these bunions managed?
So management of bunion would be to first of all to remove the inciting factor which causes bunion. As I mentioned, closed narrow shoes. So you have to avoid wearing closed narrow shoes. All your heels and other shoes which are narrow in front, especially for women, they should try and wear broad base shoes. Any sport shoes or any soft cloth shoes which are broad in front, which give space for all the toes to wiggle freely, that should be worn. Slippers are good. Most Indian people they wear and prefer because of the weather as well. So that is why bunion is not much of an issue in India as compared to US and UK, where the people get operated very often and frequently. And other important thing is some exercises of the foot, because bunion is also a muscle imbalance. You have to strengthen your foot muscles. So those are the intrinsic muscles of the foot, and you have to start pulling your toe on the other side because the toe is going out. You have to start pulling your toe on the inside, which stretches your muscle. And general other foot and ankle exercises helps to avoid bunion. Now, if that pain is not going with these exercises, with modification of footwear, then we need surgery to correct it. So, and before that, there are many splints available for bunion. People come with Amazon splints that you rotate and your big toe will become aligned. So, those all are for marketing, and they do not help to correct the bunion toe deformity. They will give you slight pain relief, so no harm in using it, but you should not be under the impression that my toe will become straight after using this for 1 month or 2 months. So to get it straight, there are surgeries. We have minimally invasive surgeries now where we correct the big toe and align it straight to the other toes. So that is possible. It has a recovery period of around 2 to 4 weeks, and then you are walking on your foot, and many people find that quite helpful and beneficial.
Yeah. So, and also many a times after trauma, our ankles do not permanently be like before it gets deformed. So, what is post-traumatic ankle deformity? So,
Yeah, so this is one more condition which we surgeons face quite a lot, is foot and ankle trauma and the deformities and arthritis which develops after that. Because of our population, the road traffic accidents, foot and ankle injuries are very common. So we have ankle fractures, we have midfoot fractures, we have list frank fractures, calcaneum fractures, which are treated. And whenever a fracture happens, the bone gets injured, but with that also the joint is injured. So the joint is the layer where you have your cartilage, just like you have in the knee, which moves up and down. That's how foot has around 26 bones, and there are more joints, around more than 14 joints in the foot, which can get injured with a foot and ankle trauma or a fracture. So once the fracture is healed, we fix the fracture, or sometimes the fracture can be managed with a plaster. But once it heals, some people get foot and ankle deformities. That is, their ankle either turns inwards or the ankle goes outward. So that is an ankle deformity, or many people get midfoot deformities. That is, they get their forefoot abduction or forefoot adduction. So these are various terms which we use, but basically your foot is not in a normal shape. There is a deformity, and we have to correct that deformity for pain relief, for your better footwear management, and for your proper walking. So we see
okay.
patients with foot and ankle deformities from post-traumatic and also with arthritis. Yeah,
Yeah, and how to manage such deformities in such cases?
correct. So insoles are one of the ways which most people we also prescribe, and they themselves hear it from their relatives, friends, and start using them. So footwear modification is very important whenever you have a foot and ankle pain. Uh, we have many over-the-counter shoes which are hard, which have buckles on it, which are tight, which are ill-fitting, and that aggravates your pain. So, to consult a doctor and get advice on proper footwear is most important. And majority of patients, they do better with some modification in footwear. And for example, if they have a varus deformity, giving a medial support to the ankle helps them, as opposed to some people who have a valgus or an outgoing deformity, giving a lateral support helps them. So these are the ways in which we correct them. However, if the arthritis has developed to a larger extent, and we have to do some x-rays and MRI scans to check that, and once we assess that, people who are good surgical candidates, then we offer them surgery. Because surgery is something which we do internally, what insoles are doing externally. So not everybody would like to wear the big shoes and insoles all throughout their life. They want to get rid of it. They want to walk barefoot. So that is quite important for many Indian patients. They like to walk barefoot. So then for that arthritis management, that deformity management, we have to correct the deformity from inside, which is with a surgery. We have many plates, screws, advanced techniques now available, through which foot and ankle deformity surgeries are done. Usually, these surgeries are quite straightforward. They are not a major surgeries. One thing in foot and ankle surgery is the rehabilitation, which people are most worried about. But nowadays, with minimally invasive techniques, our recovery time are becoming shorter. The
Hmm.
amount of duration which we put in a plaster is becoming shorter. Like initially, we used to, after surgeries, put people in a plaster for 3 months, sometimes 2 months. Now that is gradually decreasing to 4 weeks, 1 month to 15 days. And then we start people walking, or at least start their ankle range of movements in a walker boot. So walker boot is something which is given post foot and ankle deformity surgery, which is a big boot with Velcro straps. So that allows you to walk. That takes your majority weight, and people can walk and continue with their earning and activities of daily living while at the same time recovering. So hence the recovery period is now much shorter, and more people are accepting their foot and ankle deformities and getting surgeries done. So this is something which is changing in more recent days, and newer advancements are coming.
Okay, so these were the newer modalities for foot and ankle arthritis surgeries. Okay, so thank you so much, sir, for being on live session with us for such valuable insights. It was really a great session. Thank you so much, sir.
Okay,
Thank you,
thank you.
everyone.
Thank
Yeah,
you.
thank you.